Hey guys, this video I will be talking about chemotherapy. If you can't tell, I'm midway into it. Um, so chemotherapy sucks. I'll tell you how I got here. I'll tell you all about it. So let me start off by one saying that if you need actual medical help, you should be talking to a medical professional. I will caveat by saying I am an attorney, or I was right before all this kind of happened. I still am. I just haven't been working. Um, so you should definitely see a doctor. Don't take it all from me. I'm just here to try and give you some guidance to what I can give you guidance for. This video, I want to go through all of my experience so far with chemo, what to expect, different things going into it, different options going and actually deciding what chemo regimen that you're going to have to do, things like that. So, when I was diagnosed, I ended up finding out that it had spread to 2 lymph nodes in my abdomen. By the end of it, before I had actually started chemo, like right before I began, I had back pain from the growing masses. It had spread to a bunch more lymph nodes, and it had spread to nodules in my lungs. So I was not given pretty much any other option besides doing chemotherapy. Like I said in one of my previous videos, there's 2 types of chemo that they typically treat this with, kind of patented by Dr. Einhorn at Indiana University back in time. It is what cured Lance Armstrong, and it is essentially one of the reasons why this disease is so curable, is because the chemotherapy works great to actually kill off this disease. So there's 2 types of chemo, mainly. It's for this type of disease. It's etoposide cisplatin, EP, or BEP, which is bleomycin with etoposide cisplatin. So what a cycle of chemotherapy looks like for a person with testicular cancer is it's a 5-day-a-week cycle. So if you're doing the etoposide and cisplatin and the EP, which is what I'm doing, basically what will happen is you go into an infusion center for 5 days, and they'll either do it intravenously. So I opted to just do it with an IV. I get an IV 5 days in the week, either one of my arms, my hand, wherever they can get me stuck, and I sit there and I get administered the chemo. It's boring, but whatever. Bleomycin, for those who end up doing cycles of bleomycin, they'll either go by 3 or 4 cycles depending on the extent of the disease you have. So they'll base this on your tumor markers. It'll be also based on what your provider thinks. But etoposide is 4 cycles, so they'll call it EP times 4, or bleomycin times 3. And so what happens is for the EP, like I said, 5 days in a row, and then it's 2 weeks off. So typically you do your 5 days, and then I guess it'd be the next 16 days. But you have 2 weeks to recover for your body. For bleomycin, it's the same 5 days in a row, but on each of the following weeks, you'll go and get bleomycin as well, which will the same thing intravenously. From what I've been told by other people going through it, bleomycin it's short when you go and get it those 2 days, but that's how that would work. So some people opt to, the question of port versus IV versus a thing called a PICC line. So basically, some people get a port, which is a thing that they'll put in. They'll get, as a small procedure where they'll go and essentially install this thing in your neck, not like your neck, kind of like just below your clavicle, where they'll attach it to the main artery that goes to your heart. I know it sounds scary. I mean, I was scared of the idea of it, hence why I'm doing IV. But it's a lot easier from what I've been told. They pretty much would just go, and after you have it, when you're doing your treatment, It's almost like a permanent IV. Well, yeah, basically, it's a port. Like, they plug you in, and that's your thing. That's how you get your treatment in. So you don't have to get stuck every day that you're in treatment, like I am with a needle. It's personal preference, or if your doctor thinks that that's the right thing to do, then they'll do that. Going forward, intravenously, they'll give you an IV. I don't think that's that bad. Just when they miss, sometimes they'll miss your vein. As you go through chemotherapy, your veins can get tougher. It's not always guaranteed. I haven't had the worst time with it so far, knock on wood. But basically, when they do the IV for you, you just sit there, and then they'll take it out and they'll do another one, and they'll do it all the 5 days. I don't know if there's much of a benefit to either or. I know that obviously the benefit of having the port is that you don't get stuck all the time. They'll use it for blood draws. They'll use it for giving you your chemo, for anything else in between, for scans and stuff after. It seems like it makes the process a lot easier with a lot less needles. But it is a small procedure, and there is a risk of infection having one. I've seen quite a few people end up having infections with their port. There's actually a guy, he has a channel called Peyton Lifts, and years ago, and his channel's been helping me through this. He went through this whole thing quite a long time ago, maybe 7 years, 6 years. And he had a port his first week, and it looked like he got infected, and they had to basically just do IVs for the rest of it. So I'm glad I got to avoid a small surgery that ended up, having to end up with IVs anyway. My arms have not been brutalized. They're still fine. They get bruised by the end of the week, but I mean, that is what it is. I haven't had a problem with it so far. Like I said, I'm knocking on wood. But yeah, from there, let's talk about the chemotherapy side effects. So I told you I am on etoposide, so EP by 4. So I've done 2 cycles so far. I'm going to my 3rd. So I've heard that the 3rd one sucks, and I'll probably give you a video on how the 3rd one has me feeling. But basically, the side effects for chemo, they vary. So when you start, they give you a big list of things that could happen. It's a big list. I'm sure people have seen the movies, things like that. But it's essentially the main one that you're all probably noticing is hair loss. So I, right before this, had a full beard and a full head of hair. And around the 3rd week, post my first cycle, the week before my 2nd cycle, my hair began to fall out, my beard hair first. So I noticed it was just coming out. Like, I could just go like this, and I'd have a bunch of beard hair. And maybe a couple of days later, I could do the same thing with my head hair, and it would come right out. I ended up shaving my head, but I didn't shave it short enough, so it was still, you could see that there was like still hair, like, it looked weird. I looked like an old man. I found this out only a couple of days after turning 27. So I ended up just taking a straight razor to it and just knocking it out. Your eyebrows can fall out. Mine haven't, thankfully. Maybe they thinned a little bit, but I still got them. Your eyelashes can fall out. Again, I'm lucky so far they haven't fallen out. Maybe a couple did, but still holding on strong. I got great eyelashes. Your body hair will fall out. So pubic hair all fell out. However, your arm hair could fall out, still kept mine. Leg hair could fall out, still have mine. Chest hair thinned out a lot, but I still have chest hair, but it does fall out. It does seem alarming at first, but it is what it is. It'll come back. It's not forever. It's probably the most minor thing of all of this. The other side effects, the main one is fatigue. So while you're going through treatment, the actual 5 days that you're there, they give you steroid on the first day. They usually give you steroid throughout the whole week, which you don't feel bad when you get the steroid at first. You feel pretty good. The side effects typically come when you get off the steroid the following week, but you do get tired. And I mean, fatigue is, you just get randomly tired. I'd be going to sleep at 8 p.m. You might have to take naps during the day, and you don't have the same energy level. You'll feel it. Your heart will feel weird. You'll feel just tired. You'll just feel very, 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 very tired. I haven't seen anyone really avoid that one, but typically around the second week, that energy level will usually come back. But like I said, as the cycle is going forward, it's harder to keep that same energy level. Keep that same energy. All right, that was done. I don't edit these videos. I just post them in one shot, so that's staying in. Other side effects. So people can get mouth sores. I haven't had any yet, knock on wood again, but they happen. You have to use a sensitive toothbrush. Your provider should tell you that, but they make toothbrushes that are literally made for sensitive teeth. You don't want to bleed, because you can go and end up having blood clots, stuff like that. So you don't want to bleed, but you want to take really good care of your teeth too, because chemo does prevent your body from, it destroys all the bad cells, quick dividing cells, like your hair is quick dividing, but also destroys healthy cells too. So it makes, you don't want to end up at the dentist during this. There's a bunch of issues that can go with that. You want to just get this thing done without any problems. Other side effects, things will start tasting weird. Water could taste metallic. Food could taste metallic. Maybe use plastic utensils. I haven't had much of that issue so far, a little bit, but or sweeteners in your drinks. It's I've been using Liquid IV. Liquid IV has been a godsend. It's been helping me out a lot with recovery. Getting vitamins and minerals in my body while I'm getting my water intake is important. Any other side effects I'm thinking of that I've had so far? Some swelling in my feet during treatment, but that goes away. Tinnitus, you get a ringing in your ear that'll come and go. For some people, it's worse than others. Some people, it's constant. From a person I've had tinnitus as long as I can remember before this. It's just kind of a mental thing, in my opinion. You can shut it out. It's just going to take some work. And I'll go into managing the side effects later in this video. Other side effects that you'll have: joint pain, muscle pain, things like that, especially at the end of the cycle. You'll get a shot to boost your white blood cell count so you're not immune compromised. It'll help you fight off infection. So they give you Claritin, because basically this shot goes and makes your body produce white blood cells, makes your bone marrow produce white blood cells, so you'll have bone pain. So you'll feel pain in your forearms. Some people get in their head, their legs, their hips, their back. And so one of the good ways to combat it, and your provider will give it to you, is by giving you Claritin or other allergy medication. Nausea. I haven't had a lot of nausea yet. Again, knock on wood, I haven't had any. It seems that the medications that they give nowadays for chemo are pretty dialed in, so you can avoid nausea. But that being said, I've seen plenty of people still get it, especially in the later cycles. I'm really hoping I don't, but like I said, I'll go into management for side effects after I'm done going through the general side effects for it. What else? So I've got through the feet, the exhaustion. Some people will get neuropathy, which is a tingling, pins and needles kind of sensation in different parts of your body, your hands and your feet. It's an unfortunate side effect of this thing. There's not a lot you really can do for it, but it's just something to look out for and tell your doctor when that happens. Heart palpitations or high blood pressure, same thing. You have to just tell your provider. hey, this is happening to me, and they'll either adjust your dose or things like that to make sure that you're good. Additionally, becoming neutropenic, which it's not much of a side effect, but more of a thing that for them determining whether or not you can go and keep going forward with chemo. These are all just things to look out for while you're going through it. Exhaustion is probably the main one. Now I'll talk to you about managing the side effects. So one of the good ways to manage fatigue is to fight back. Typically, going for walks, light exercise, things like that. You don't want to become a couch potato. You don't want to become bedridden, although it's okay to take naps. Be kind to yourself. Be easy on yourself, and be fair. You don't want to end up in a spot where you're just dead exhausted all the time. You don't want that. It's actually helpful for your energy level to try and keep up with going on walks or doing things like that. And it frankly has made this whole experience a lot better. I go for long walks with my mom. At the end of every day, I try and walk about a mile each chemo day. And then once I feel better, I try and go on longer walks throughout the week. And then the following week, same thing. I try and just progressively get my energy level back up by just combating it. Nausea, to combat nausea, definitely worthwhile to take your medication around the clock when you have while you're going through treatment. They'll give you an anti-nausea while you're there, and then they'll prescribe you one to take home to take whenever you need it, along with maybe an anti-anxiety or things like that. But take them when you can. Even if you don't feel nauseous, it's the right thing to do, and it's gonna save you in the long run. Another big one is hydrate. Hydrate is probably the most important one, which I should have said very first thing, but hydrate to no end. My first cycle, I actually had a worse time than my second cycle, and that's because my second cycle, I made it sure that I drank at least more than 2 liters of water a day, even with liquid IV in it. Just getting the most that you can. It's super, super helpful. It helps you flush out all the chemo drugs in your body. It gets everything out. You want the drugs to get in your body, do its job, and then leave. That's what you want it to do. You don't want to hang around. You don't want to linger. You want it out of your body as soon as you can get it out. And so drinking water and urinating is the best way to do it. Try and get as much in as you can. Train yourself. Get that water in. Now, between my off cycles and everything else, I think the 2 days before chemo, I pound water, pound Gatorade, and then same thing during the cycle. I just get as much in as I possibly can throughout the day, everything I can do. The other one is eat. You need protein. You need protein for your body to recover from chemo. Your body needs protein as a building block to be able to recover everything well. You need to eat. Things will taste bad, whatever it is, whatever you got to do, just eat. There's no diet that doctors typically prescribe for testicular cancer. They just tell you to eat whatever you can. I've seen people have better outcomes in terms of side effects for healthier diets, juices, things like that. But that's that. Otherwise, exercise to some degree, walking, anything else helps. And hydrating, if you have an IV too, hydration helps them to find your vein. And it will make your experience a lot less painful. And it'll make the side effects more mitigated than they would be if you weren't hydrating like crazy. Otherwise, chemotherapy hasn't been the worst thing in the world so far. It's doable. It's manageable. It's hard. It's hard doing it. This has probably been my least favorite experience of my life so far. And managing the chemotherapy side effects is super, super important for you to make it through this. And same thing for your body recovery, so you can actually be able to go into your next cycles and the doctors say that you're cleared to go and keep doing it. Otherwise, if your body's not repaired and it's not ready to go and handle the last one, they're not going to let you go on. It might delay your treatment. It might delay the outcomes. So make sure that you hydrate. Like I said, for mouth sores, for your mouth, you're going to feel your mouth feel different. Be on top of it. Use those the soft toothbrushes, and it is a godsend to not have had any so far, any mouth sores, but you gotta take good dental health. Another thing that I forgot is constipation. Constipation is actually something that can happen pretty often during chemo. Like I said, drink water. Water helps. Peptid for indigestion. You can buy it over the counter. It's really, really good. Also for your mouth, they make Biotine. Biotine is a mouthwash that's good for this too. It's helpful to negate any mouth issues that you're having. It's just a really good mouthwash. Stay away from alcohol. I don't really know who wants to drink while they're feeling like garbage anyway, but they tell you not to drink alcohol. I'm telling you, don't do it. It's a short period of time, 2 months. Just don't do it. There's no reason to do it. Like, just don't. Like, of all things I've said, just don't drink. There's no reason. Don't smoke cigarettes and don't drink. Like, come on, guys. But yeah, so that's pretty much, I think, for this one on chemo, what it is, how to mitigate it in the most broad sense of the word. If you have any questions for me and going through it, like I said, I start my third cycle coming up on Monday. If you're watching this, wish me luck, send prayers. And if you're going through it, I'm sending mine too for you.